Good morning, everyone. My name is Robert Hersey. Happy Thursday to each of you. And on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar titled Florida Substance Use Trends Annual Report 2024. This webinar is being made available through a collaboration of the Florida Department of Children and Families and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and are only able to view your name. Your webcam and microphone have been disabled. If you have questions, please send them to all panelists by using the chat panel. The button to open the chat panel is usually located on the upper right side of your monitor. Please use the chat panel to send any questions you may have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio at any time during today's presentation, there are a few options to try using the Communicate menu. For computer audio, click Communicate menu, then click the Audio Connection panel. Click Disconnect, click Communicate menu and Audio Connection again, then click Call in using computer and follow the instructions. If you continue to explore poor audio through your computer, try using the I will call in option under the Communicate menu. The access code and event password are posted in the chat panel. You must be connected to both the audio of this presentation as well as viewing it on screen to receive a statement of completion. We are unable to verify attendance if you are not connected to WebEx via your computer or mobile device. Therefore, audio-only attendees will not be eligible for a statement of completion or CEUs. The recording and materials used in today's presentation will be available on the FATA website within 30 business days. To access the recording and PowerPoint, visit www.fata.org, navigate to the Resource Center, and click on Training Library as shown on the screen. FATA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. A statement of completion and CEUs for up to 2 continuing education credits are available for participating in today's webinar. CEUs are available for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, Mental Health Counseling, and for persons credentialed through the Florida Certification Board. Completing the evaluation is necessary to receive CE credits or to access your statement of completion. Please note that the evaluation will close at the end of the day on Tuesday, June 25th, 2024. At the end of today's webinar, you will have 3 opportunities to complete the evaluation. I'll post a link in the chat. You will receive a follow-up email from WebEx, and your web browser will populate a redirect link once I end the webinar. To complete the evaluation, you will first need to register or sign into your account. Please ensure that your name and email address match the name and email used when you registered with WebEx. Information you provide FATA as part of registering remains confidential. If you are a licensed healthcare practitioner, be sure to include your Florida license number for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside the state of Florida, you do not need to provide your certification number when you register with our site. If you need assistance with account registration, login information, or accessing the evaluation, fill out a contact form on our website or email training@floridabha.org before June 25th, 2024. Please note that WebEx monitors the arrival and departure times of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credit. Statements of credit will be posted within 30 business days after the evaluation closes in the professional development section of your FATA account. For licensed practitioners, CEUs will be reported to CE broker within the same time frame. Please note that this presentation is intended solely for educational purposes. The views, opinions, information, and content expressed in the presentation are those of the presenter and do not necessarily reflect the views, opinions, or policies of the state of Florida, the Florida Department of Children and Families, the Florida Alcohol and Drug Abuse Association, or the Florida Behavioral Health Association. Attendees should note that sessions are recorded and published in various media. Now I'd like to introduce our presenter, Ben Hackworth. Ben has over 5 years of experience providing community presentations, technical assistance, and training on substance use and mental health prevention services. As an independent contractor, he collects, analyzes, and evaluates data for local, state, and national dissemination through written reports and oral presentations. Ben previously contracted with the Center for Substance Abuse Research as a Sentinel Site epidemiologist for the National Drug Early Warning System, funded by the National Institute on Drug Abuse. Ben graduated with a Master of Public Health from the Northwest Ohio Consortium for Public Health, a joint collaboration between the University of Toledo and Bowling Green State University. His specialization is in health promotion and education. And now I'd like to welcome our presenter, Ben Hackworth. Ben, I will turn it over to you.
Thank you, Robert. I really appreciate the introduction. Good morning, everyone. I hope everyone's having a great morning and excited to hear some information about data in Florida. So again, my name is Ben. I'll be presenting the Florida Substance Use Trends Annual Report for 2024. The objectives today for the webinar is to identify updates in substance use trends in Florida and also the US. We'll try to understand patterns of substance use regionally and throughout the state. And then we'll also identify substance use trends for fatal and non-fatal overdoses in Florida. Just a brief introduction for the 2024 annual report on substance use trends in Florida. This report is an update from the 2023 annual update report issued in February 2024. So the data I'll be presenting on is updated information from the past report, and we'll update you on mostly on substance use and also mortality with different drugs that are found in the medical examiner's annual report for 2022. A lot of the data is also updated for the NSDUH data, which is the National Survey on Drug Use and Health, with this most updated survey for 2021 to 2022. So let's go over some of the data that we'll be presenting on. The data in this report is based on recent data from the Center for Disease Control and Prevention. We'll go over the US drug death data from the CDC. And I was able to get a lot of good information from the Florida Health Charts, which is found on the Florida Department of Health website. We'll go over some overdose rates and also emergency department visit data from the Florida Health Charts. This is really good information to use and is available for everyone as well. Next, I used some data from the Drugs Identified in Deceased Persons by the Florida Medical Examiner's 2022 annual report. And we'll go over the number of occurrences that we see for different drugs that are reported in this really great report that is generated from all different medical examiners throughout the state. And then we'll also go over the 2023 Florida Youth Substance Abuse Survey, otherwise known as the FISUS. There will be some data on the Monitoring the Future survey, which surveys 8th, 10th, and 12th graders throughout the nation. And we'll also, again, be using data from the National Survey of Drug Use and Health, or NSDUH, as I'll be referring to it in the next coming slides. So the methodology for this report is as follows. The Florida Youth Substance Abuse Survey assesses risk and protective factors for substance use and is administered to Florida's middle and high school students. So again, we'll be utilizing this data to compare lifetime and past 30-day use within a time span. Additionally, data on substance use among adults and youth throughout the US and Florida will be utilized from the National Survey on Drug Use and Health, or NSDUH, as I mentioned earlier. And this is sponsored by the Substance Abuse and Mental Health Service Administration. This source provides prevalence of substance use based on survey response. So the surveys are self-reported. They are also gathered in 2-year averages. So I'll explain that when we get to some of the graphs, what that means and what that looks like when we're diving into the data more. Next is for morbidity. We'll be looking again at the hospitalizations and emergency department visits for drugs and opioids. This will be coming from the Florida Health Charts that's provided by the Florida Department of Health. Again, this is a really good resource to have to compare morbidity rates in Florida and the overall age-adjusted rates as well. Data on the number of occurrences among drug deaths in Florida is updated by the Florida Medical Examiners Commission 2022 annual report, which will be used at the end of the presentation. Towards the end of the presentation, we'll be going over some of the managing entities to compare and contrast to see what the rate per 100,000 population is. And this is information that's helpful to try and decipher where we're seeing an influx of drug overdose deaths and so forth. And so the Florida Department of Children and Families contracts with 7 regional systems of care known as managing entities to provide behavioral health services to people throughout the state. Because Florida is such a large state and very diverse, this model allows each managing entity to respond to specific behavioral health needs of its regions in Florida. So as you can see here, there's different regions, and in blue, we have the Northwest Florida Health Network. This consists of a population of about 1.6 million people, or about 7% of the state's population, dispersed throughout mostly the panhandle of Florida. Next, we have in yellow, Lutheran Services, Florida. This population is about 4.4 million people, or about 19% of the population for the state. We have the Central Florida Behavioral Health Network in the rust color. This is the largest region for population size, with about 6.4 million people and taking about 28% of the state's population as well. Next in orange is Central Florida Care's health system. This is about 3.0 million people and about 13% of the population. In the pink salmon color is Southeast Florida Behavioral Health Network, which is about 2.2 million people and about 10% of the state's population. Next, we have Broward Behavioral Health Coalition. And then lastly, the Thriving Mind South Florida, consisting of Monroe and Miami-Dade, with about 12% of the state's population. So again, this will come up towards the end of the presentation, where we'll go over the managing entities and the differences in those. So to jump right into some of the data, we'll go over past year pain reliever use among adults in the US and Florida from 2015 to 2018. This data comes from the NSDUH. And to explain some of the data plots, the surveys are taken from, the data plots are from 2-year averages. So for example, you'll see 2016 to 2017 data plotted in the middle of those 2 years. Up until 2021, due to the COVID-19 pandemic, the survey only had 2021 data available. And so due to this, it's a little harder to compare data from previous years. And then in 2021 to 2022 survey year, they changed the methodology a little bit as well. So on their website, it's cautions to compare these 2 years to previous data. So I want to put that out there that some, comparing this should just be used in caution. And there's some data points that we'll see that are like flukes, but for the most part, we'll see similar trend lines from previous years. So to go over this graph, again, this is self-reported pain reliever use among adults in the past year, shown here. The US data points are shown in purple, and Florida data points are shown in green. We see overall a downward trend line to pain reliever misuse among adults in Florida and the US. For the 2021 to 2022 survey results, US adults remain at the same rate of use from the previous survey year at 3.2%, and Florida adults slightly increased to 2.7%. Again, comparing survey result years should be used with caution, but can help us with a general understanding of self-report use for these specific substances. Past year pain reliever misuse among youth is shown here from 2015 to 2022 for the US and Florida. Again, the US is shown in purple and Florida in green. For youth, we see similar decline in rates for pain reliever misuse. Again, the rate for the US youth remained the same for the current survey year as it did from the previous survey year. And Florida youth reported misuse at 1.9%, which is a decrease from the previous survey year. This data comes from the Florida Youth Substance Abuse Survey, and we'll look at lifetime and past 30-day pain reliever misuse among youth in Florida from 2010 to 2023. Past 30-day use is shown in purple, and lifetime use is shown in green. So according to the FICES, Lifetime misuse of pain relievers have decreased by 67% from 2010 to 2023. For past 30-day use, rates have decreased by almost 69% from the same time frame. Overall, youth in Florida have reported the lowest rates of misuse of pain relievers in 2023. Some additional data that we'll go over for pain reliever misuse comes from the Monitoring the Future survey. This is a survey that usually gathers information from 8th, 10th, and 12th graders throughout the nation. However, for this specific question, they asked 12th grade youth only about their prescription pain reliever misuse from 2015 to 2023 is shown here. So we see decreasing trends from the time frame, just like the NSD-UH data. You may notice a sharp decline in 2021. So investigators and researchers that work with the Monitoring the Future survey said that COVID had such a dramatic impact on our youth and their behaviors. And there could be a number of reasons why we see this dramatic decrease that occurred in 2021. But they point to a number of reasons, which whether it's related to drug availability, family involvement, differences in peer pressure, or other factors, we see such a dramatic decrease occurring in 2021. And again, this was due to the COVID pandemic, but a lot of other factors could have been in play as well. They also mentioned that while drug use decreased in this survey year, mental health decreased along with other factors like loss of sleep, increase in anxiety, lonesomeness, depression, and etc. However, in 2022, reported use of illicit drug use within the past year remained or at least remains significantly below the pre-pandemic levels for all grades. And this goes for all the substances in the Monitoring the Future surveys that we'll highlight in the upcoming slides. And then finally, the percentage of adolescents reporting that they used any illicit substance in 2023 continue to hold steady below the pre-pandemic levels reported in 2020. So again, when I show the Monitoring the Future surveys, I think all of the substances will have this dramatic decrease in 2021. So just remember that the investigators and researchers believe it's due to COVID and those other factors that I listed. But we also see mostly for 2022 and 2023 similar levels of rates that are lower than they were pre-pandemic. So overall, just looking at this chart as well for 12th grade youth, the green line shows lifetime use, and in 2023, 8.5% of seniors throughout the nation reported pain reliever misuse, while only 2% used pain reliever, prescription pain reliever misuse in the past 30 days. Now we can move on to heroin. And this data comes from the NSD-UH survey. So heroin use among Florida adults is consistently lower than US adults, as you see here. And for 2021 to 2022 survey year, we see that Florida adults reported 0.24% of heroin use in the past year, while US adults reported 0.42% of heroin use in the past year. So these are pretty much lower numbers than prescription pain reliever misuse. As far as youth, it's considered for heroin use for the US and Florida from 2015 to 2022. According to the NSDUH, we've seen a sharp decrease in heroin use for Florida youth since 2015. It went from 0.22% to practically zero. So youth rates for 2021 and 2021 to 2022 survey years are plotted at 0. So this means that youth prevalence rates are basically not reported at 0 because there are no respondents reporting use of heroin in the past year. Heroin use for lifetime and past 30-day use for youth in Florida is shown here from the FISIS. We see very low rates as well for lifetime and past 30-day use in Florida. Past 30-day heroin use has remained at 0.2% for the past 3 survey years. And it's also decreased since 2020 for lifetime use, with only 0.3% of youth in Florida reporting lifetime use. Moving on to cocaine. Past year cocaine use among adults in the US and Florida is shown here from 2015 to 2022. Cocaine use among adults is more common than heroin use, but less common than prescription drug use. The highest prevalence rates are shown from 2017 to 2018. And there was a slight increase for both the US and Florida adults with the recent survey from 2021 to 2022, with 1.5% of Florida adults using cocaine in the past year and 2% of US adults using cocaine in the past year. Moving on to cocaine use among youth, according to the NSDUH data, cocaine use for both the US and Florida has decreased over time. And the US and Florida youth report cocaine use in the past year, both at 0.14%. Cocaine use among youth in Florida, according to the FISIS, is shown here. Again, lifetime use has decreased a lot from 2.9% to 0.7% in 2023. And for past 30-day use, we continue to slowly see a decrease from 0.8% in 2010 to 0.3% in 2023. Next, we'll move on to self-reported methamphetamine use among adults. Methamphetamine use among US adults has increased to the highest prevalence rates that we've seen in the past survey years to 1.0%. So we've seen an increase for US adults. However, for Florida adults, we see the increase in the most recent survey year It went from 0.56 to 0.60% for methamphetamine use in the past year. Methamphetamine use among youth for past year use is shown here from the NSDUH data. The highest rates for US and Florida youth were seen in 2017 to 2018 survey years. In the most recent survey year from 2021 to 2018, we've seen declines for both US and Florida. And the rates are also pretty close to each other, with Florida youth reporting 0.09% and US youth reporting 0.10% of methamphetamine in the past year. The FICIS also has data for methamphetamine use for youth in Florida from 2010 to 2023. Past 30-day use has stayed pretty consistent between 0.3% and 0.5%. And lifetime use has seen a decrease since 2020. So from 2020 to 2023, we see a continual decrease as well. For past year marijuana use among adults in the US and Florida is shown here from the NSDUH data. Marijuana is the only substance to continually increase in past year and past 30-day use among adults in the US. Nationally, past year use of marijuana is at 21%, while reported past year marijuana use at 17.8%. So we see a gradual increase continue for adults in the US and Florida for past year marijuana use. For past 30-day use with marijuana, we see similar trend lines as we did from the previous slide for lifetime use. But with past 30-day use, we saw an increase in the most recent survey for both US and Florida adults. With adults, with US adults reporting 14.9% and Florida adults reporting 12.7% of past month marijuana use. Marijuana is the second most used substance in Florida and the US as well after alcohol. And again, we see continual increases in trends for adults for marijuana. When it comes to youth, though, with past year marijuana use, we see a small downward trend, but the trend lines are pretty similar for both the US and Florida, with very close reporting of use. So past year marijuana use is on a slight downward trend and up until the most recent survey, with the US reporting 11.2% of past year marijuana use, and Florida youth reporting 10.4% of past year use for those youth. When it comes to past month marijuana use for youth, the rates are more steady And we see the big drop in rates for 2021. I'm not sure why there was such a huge drop in prevalence rate for Florida youth in 2021, but I think just like the Monitoring the Future survey, maybe COVID-19 pandemic had something to do with self-reporting and the drop and decrease. But after 2021, we have the most recent survey reporting for 2021 to 2022, and the rates are back up to pre-pandemic levels but slightly lower at 6% for Florida youth, and then 6.3% of past month use for US adults. To continue on with marijuana use for youth in Florida, we'll look at the FICIS from 2010 to 2023. There's a slow decrease in marijuana trends, just like we saw in the previous slide, up until 2020. And after 2020, we saw a sharper decrease in self-report lifetime and past 30-day marijuana use for youth in Florida. So, for example, for lifetime use, it only declined from 23% to 20% from 2010 to 2020. However, and this also same time period from 2010 to 2020 for past 30-day use also only declined by 3%, as you can see there in purple. But however, after 2020, again, could be because of the pandemic and so forth, we see rates dropping much sharper. And we see the lowest levels of marijuana use for lifetime and past 30-day use at 14.2% for lifetime use and 7.4% for past 30-day use. This graph is from the Monitoring the Future survey, which surveys 8th, 10th, and 12th graders nationwide. And again, with the exception decline in rates during COVID of 2021, we see about a 2% decline in rates for lifetime marijuana use among 10th and 12th graders. And then 8th graders report a 0.5% increase, leaving a stable trend line from 2022 to 2023. However, again, we're seeing pretty low self-reported levels of marijuana use when it comes to pre-pandemic self-report rates. Next slide is the past month marijuana use for 8th, 10th, and 12th graders. We see similar trends in past month marijuana use with about a 2% decrease in rates for 10th and 12th graders in the US from 2022 to 2023. And then we see another stable trend line for 8th graders, only decreasing by 0.3% from 2002 to 2023. On another note, the 2023 Monitoring the Future survey only asked 12th graders about their use of Delta-8 THC, which is a psychoactive substance found in the cannabis plant of marijuana and hemp. and these are two different varieties. And they used this, they started using this measure for the first time in 2023, but the 2024 survey will ask 8th and 10th graders about their Delta 8 THC use. So I wanted to make you all aware of this substance, and I'm kind of wondering if you're seeing Delta 8 use among your youth in your communities. I think it's interesting to see that a new substance might be emerging, and to have the substance on the Monitoring the Future survey might be telling of what we're seeing in our communities. So I'm just curious about that and wanted to point that out as well. Next, we'll go over vaping data. So in 2016, the Florida Youth Substance Abuse Survey asked if youth have ever used electronic cigarettes and inquired their current use as well as lifetime use. However, the survey added new questions for e-cigarettes in 2019. So the survey now asks respondents for lifetime and past month use for electronic cigarettes, for nicotine and marijuana separately. So this slide here shows vaping nicotine among youth in Florida, and we see that 12.5% of Florida youth reported using an electronic cigarette for nicotine in 2019, and 7.8% reported vaping nicotine in 2023 in the past 30 days of the survey. Lifetime use has dropped from 23.5% to 16.6% for ever using an electronic cigarette for vaping nicotine during the same time period. Vaping nicotine for Florida youth is the second most used substance after alcohol. The Monitoring the Future survey asked questions about vaping nicotine as well for 8th and 10th graders across the US. And their survey question first popped up in 2017. So we see the highest rates of lifetime use across all grades were reported in 2020. After 2021, rates for vaping nicotine for 8th graders has remained stable with about 16.5% currently or have ever used a vape pen for nicotine in 2023. And then 10th and 12th graders have reported decreases in use in the most recent survey in 2023, with 33% of 12th graders ever using a vape pen for nicotine and 25% ever using an electronic cigarette for nicotine for 10th graders. We can also look at past 30-day vaping nicotine rates for 8th and 10th graders across the US, and we see similar trend patterns from the previous slide. Again, we see the highest rates in 2020, and 8th graders have pretty much remained a stable rate of use from 2021 to 2023, whereas 10th and 12th graders have again decreased their use from 2022 to 2023. Going back to the physis data, we'll look at lifetime in the past 30-day vaping marijuana among youth in Florida. And these rates are much lower than vaping nicotine. And the trend lines are also pretty similar to the nicotine trend lines that we saw earlier. And we continue to see a slight decrease in rates. So again, rates are generally lower for vaping marijuana than they are for vaping nicotine, as it's more popular to vape nicotine for Florida youth. And the most recent survey reports that currently 6% of youth have used a vape or electronic cigarette to vape marijuana in the past 30 days, whereas 11.8% have ever used in their lifetime. And then for the Monitoring the Future survey, they also ask about vaping marijuana. About half the rates of lifetime use is seen across all 3 grades for the US youth when compared to vaping nicotine. I thought this graph is also interesting to look at and see that 10th and 12th grade youth were using at almost the same rate from 2017 to 2020. But since then, there's been a separation of rates for all grades. So about for every other grade, you double the rate of prevalence. So with the most recent survey data, we see that 8th graders continue to slightly increase their lifetime use of vaping marijuana from 2021 to 2023, whereas 10th and 12th graders have decreased their use from 2022 to 2023. Past 30-day vaping marijuana use is shown here, and they have similar trend lines, again, with 12th and 10th graders having almost similar prevalence rates of use up until 2020. And then we start seeing the separation starting in 2021, with rates varying per grade. Again, 8th graders have remained stable for their use from 2022 to 2023 at 4.2% of ever using in the past 30 days. And then 10th graders have decreased, as well as 12th graders for the most recent survey as well. However, one thing I wanted to note about these slides is I said earlier about how the Monitoring the Future survey researchers have noted that rates in the most recent survey have shown still very low levels pre-pandemic. However, the rates are different for vaping marijuana and vaping nicotine. They are not at the same levels as they were pre-pandemic, as you can see here. So we see pretty high levels of vaping marijuana and vaping nicotine for youth across the US, even before the pandemic. So I think this is the only substance that isn't continuing to decrease after the pandemic for youth across the US. We'll move on to alcohol, which is the most common substance for adults to misuse in the US and Florida. This data is from the NSDUH, and we see rates lower in the most recent survey years. However, there was a slight increase from the 2021 survey year. So for US adults, we have 52.2% using alcohol in the past month, and then 53.3% of Florida adults using alcohol in the past month. For a past month, binge alcohol use among adults in Florida is shown here, and it's much similar to past month alcohol use. There's a slight drop in rates from 2019 to 2020, and the most two recent survey years has remained pretty much the same. So again, you see here, Florida adults using at 21.7% for both those survey years. And then alcohol use for adults in the US only increased by 0.2%. So they've overall remained pretty stable. For our past month use of alcohol among youth is shown here from the NSDUH data. And the survey years have been pretty stable from 2015 to 2020. However, in the 2021 and 2021 to 2022 survey, it shows lower prevalence rates for alcohol use for past month use. The 2-year survey data for the most recent survey for Florida youth reports at 6.5%, and US youth reporting 7.0% for alcohol use in the past month. The FISIS data also shows lifetime and past 30-day alcohol use. This is the most commonly used substance for Florida youth. And although it's the most common substance, we've seen great prevention work around alcohol use in Florida, with almost half of the youth reporting using alcohol in their lifetime in 2010 to just over a quarter reporting alcohol use in their lifetime in 2023. The same decline can be seen in past 30-day use in purple, from 28% in 2020 to just 11% in 2023. The Monitoring the Future survey is shown here for lifetime alcohol use for 8th and 10th graders. 12th graders were able to decrease their rate of alcohol use from 2022 to 2023, while 10th and 8th graders had rates that remained the same from 2022 to 2023. These rates are still lower than pre-pandemic rates, so I wanted to point that out as well. Past month alcohol use is shown here for 8th, 12th, and 8th, 10th, and 12th graders. Again, 12th graders reported lower prevalence rates of using alcohol in the past month, but rates have remained the same and stable for 8th and 10th graders from 2021 to 2023. Next, we'll look at binge alcohol use among youth in the US and Florida. Highest rate for Florida youth was reported in 2017 to 2018 and has decreased to just 2.8% in the 2021 to 2022 survey. And then US youth reported binge alcohol use at 3.6% in the most recent survey. Just as we saw with lifetime and past 30-day use of alcohol, binge alcohol use among youth in Florida has also seen a sharp decrease from 2010 to 2023. So with the similar patterns, we see a declining rate of use, and rates between 2018 and 2020 remain stable from 6.8 to 6.7%. But after 2021, Florida youth have been able to decrease their reported use of binge alcohol use. And in the most recent survey, we have 4.8% of youth using our binge alcohol use and this is the lowest rate we've ever seen. And then we'll go over some other substances for Florida youth, specifically from the FICIS. Lifetime and past 30-day inhalant use among youth is shown here. So inhalants refer to various household products such as solvents and aerosol sprays that are only used through inhalation. This is used primarily by children and youth. So this is why only inhalant uses among youth is reported. So both lifetime and past month use of inhalants among Florida youth has decreased from 2010 to 2016. Both lifetime and past month use has fluctuated slightly since 2016, but the lowest rates have still been reported in the most recent survey in 2023, with 5.3% of youth ever using inhalants in their lifetime and 1.5% of youth using inhalants in the past 30 days of the survey. And then lastly, we'll go over lifetime and past 30-day club drug use among youth from the FICIS. Club drugs earned its name as a group of substances commonly used by youth and young adults. And these club drugs are a mix of drugs from various classes, including GHB, ketamine, LSD, MDMA, ecstasy, and so forth. So that's the list of drugs that is categorized under club drug use. And so for Florida youth from 2010 to 2023, we've seen a decrease. Other than the 2020 survey, there was a slight increase in both past 30-day and lifetime use. However, we're still at the lowest ever reported rates in 2023 for both lifetime and past 30-day use, as you can see here. And so the next couple of slides, I'll go over Florida morbidity and mortality rates. And so I think it's a good time to take a break, and I'll switch it over to Robert.
All right, everyone, we're going to take a 5-minute break. I have that it is 10:59, so if you'll be back at 11:04. All right, Ben, you want to go ahead and get started with the second half of the presentation?
Sure, thank you. Okay, so just to reiterate, we went over a lot of self-reported data from the National Survey on Drug Use and Health, also the FISIS, and Monitoring the Future survey as well. Next, we'll be going over specific data for morbidity and mortality when it comes to drug use and opioid use in Florida and the US. So this chart here is all drug non-fatal overdose emergency department visits in Florida from 2015 to 2022. Emergency department data can be important to serve as an early warning system to alert communities of changes in drug overdoses. This data is usually rapidly available within 24 to 48 hours of an ED visit and can tell a story of what communities are seeing with overdose cases. Emergency department data is also interesting to use because it usually follows the same trend lines that we see with drug overdose deaths and the opioid epidemic in general. On this graph, we see the number of visits increasing from 2015 to 2017, with a staggering 41,000 emergency department visits for non-fatal drug overdoses. There was a decrease in 2018, just like there was in the drug overdose death rate. But as you can guess, there's been an increase in non-fatal drug overdose visits from 2018 to 2021, with the highest ever reported number of ED visits at 50,803. The good news is, which I'm foreshadowing for a couple of slides that will see in the next couple uh, slides, is that for the first time since 2018, we've seen a decrease in emergency department visits for non-fatal overdoses occurring in 2022. So although the number of ED visits has decreased by just shy of 5,000, 2022 has the second highest non-fatal drug overdose emergency department visits ever recorded. So this is really good news that we're having our first decrease in emergency department visits. And, although the numbers are still pretty high, it's still really good news. And we'll see some more good news in the upcoming slides. Looking at emergency department visits for opioid-involved non-fatal overdoses, we see similar peaks and valleys from the previous slide. So there was a height in ED visits for opioids in 2017, and then there was a decrease in 2018, and it continued to rise up until 2021 with over 23,000 emergency department visits for opioids. But again, in 2022, we see a decrease of just under 20,000 non-fatal opioid overdose visits for 2022. Fatal drug overdose deaths in the US is shown here from 2015 to 2020. In 2015, Florida's fatal drug overdose death rate was lower than the US rate at 15.5 versus 16.3, but has since had a higher overdose death rate. So you see here, Florida is in green and the US trend line is in purple. As you follow the years, the trend line for the US and Florida mirror each other, except for the most recent data in 2022. So again, for the first time since 2018, the drug overdose death rate in Florida has decreased from 37.5 in 2021 to 35.2 in 2022. This is a 2.8% decrease. So this, again, we're seeing really great news here with a decrease in the death rate for drug overdoses in Florida. For the US, though, the death rate has plateaued and actually increased by 0.2. Some attributing factors are the widespread use of naloxone, availability of medication-assisted treatment, and community education in the state of Florida. Again, overall, this is really great news for you all in the state of Florida and your communities that you work with. Although the state has some really great news right now, we still are at some pretty high overdose death rate numbers. So there's still a lot more work to do, but a good first win for Florida. We can look specifically at fatal drug overdose deaths in Florida from 2015 to 2022. And these are similar trend lines that we've seen in previous slides. So with the drug overdose death rate decreasing in Florida, this also means that the total number of drug overdose deaths has decreased. So as you can see here, there were just over 8,000 drug overdose deaths in 2021. And in 2022, the number of deaths decreased to 7,769. Again, these are some of the highest number of drug overdose deaths that has ever been reported in Florida, but a decrease in deaths is always good news. Similar as the previous slide, we can look at fatal opioid overdose deaths in Florida. And specifically with opioid deaths, it's, again, similar patterns as the previous slide, where we also saw a decrease from 6,442 deaths in 2021 to 6,157 deaths in 2022. Again, this is the first decrease in opioid overdose deaths since 2018. So these are really great numbers. A decrease is always good to have. Hopefully we can continue on when we get data from 2023, and hopefully we'll continue on with a decrease. Next, we'll look at the data from the Medical Examiner's Commission report for 2022. And we'll move into the number of occurrences by drugs that is reported from each of the medical examiners throughout the region of Florida. The medical examiners determine what drug caused the death of the decedent and which drugs were also present at the time of death, if any. So these two numbers make up the number of occurrences. The chart shows 3 prescription opioids that the medical examiner showcased in their annual report, as they are the most abused prescription opioids. The 3 prescription opioids are oxycodone in purple, hydrocodone in green, and methadone in orange. Oxycodone has the highest number of occurrences among the 3 listed, with just over 1,000 occurrences reported among all decedents in Florida. All 3 also had a decrease in percentage change from 2021, meaning the number of occurrences for all 3 decreased from 2021 to 2022. One interesting fact for the for hydrocodone is that this this prescription opioid is most commonly used in a manner of death for suicide, which about out of the 447 total number of occurrences in Florida, 23% of those were found to be abused for suicide at the when the death was determined at the time of death. And so the breakdown of the managing entities is shown here, and we're looking at the rate per 100,000 population on the right-hand side. The rate per 100,000 population is calculated by the number of occurrences for each managing entity divided by the managing entity population and multiply that by 100,000. And so this is why I pointed out the importance of the managing entities and the map at the beginning of this presentation, because I showcase all of the managing entities and the rate per 100,000 population in the upcoming slides. So, and it's also important to have this because to calculate the rate per 100,000 population, because all the regions have a different number of population, and so just a little foreshadowing. Central Florida Behavioral Health Network has the highest number of occurrences usually in most of the upcoming slides because they have the highest population for among all the managing entities. However, when you look at rate per 100,000 population, we see that actually Northwest Florida Health Network has the highest rate, death rate for prescription opioids at 6.8. So this is why rate per 100,000 population for each managing entity is important. And the lowest rate for prescription opioids was in the Thriving Mind South Florida region at 1.8. Looking at heroin-related deaths among decedents in Florida is shown here from 2012 to 2022. Heroin was the defining drug for the second wave of the opioid epidemic, and the second wave is definitely depicted here in this graph with heroin-related deaths in Florida from this 10-year time span. And we see this bell curve with the highest number of heroin-related deaths reporting in 2017 with 1,057 heroin-related deaths. Florida has seen a continuous decrease in heroin-related deaths since 2019. And we know that the number of deaths from heroin has continued to decrease. The number of occurrences for heroin has decreased from 2017 to 2022 with only 227 heroin-related deaths, making it one of the lowest number of occurrences in the state since 2014. So this is, again, really good news. We're continuing to see a decrease in heroin-related deaths. Although this was the second wave of the epidemic, we know what the third wave was, which took over was taken over by fentanyl. So yeah, this is definitely something that isn't as prevalent as it used to be. And for the US, age-adjusted rate of drug abuse or drug overdose deaths involving heroin in the US has also decreased by 35% from 2021 to 2022. For Florida, in that same time frame, it's decreased about 51%. So again, heroin-related deaths are continuing to decrease. as we can see here. For the managing entities, heroin-related deaths is shown here for 2022. The highest number of occurrences was found in the Southeast Florida Behavioral Health Network region with 59 occurrences, followed by Central Florida Behavioral Health Network, close in second with 58 occurrences for in 2022. However, due to population size and calculating the rate per 100,000 population, Southeast Florida Behavioral Health Network had the highest death rate at 2.6, whereas Thriving Mind South Florida had the lowest number of occurrences with only 8 heroin-related deaths and a death rate of 0.3. The third wave of the epidemic, as we know, involved illicit fentanyl and fentanyl analogs. The graph shows the occurrences remained stable from 2012 to 2013. Then an increase occurred until 2017 to 2018 when there was the number of occurrences plateaued. And up until 2021, the number of occurrences increased 145% from 2018 to 2021. Again, great news. Florida has reported a 21% decrease in fentanyl and fentanyl analog related deaths from 2021 to 2022. It's been a long time coming seeing the number of deaths decrease across the state for fentanyl, but in 2022, we've seen a decrease and we even have a lower number of occurrences for 2022 than 2021 and 2020 numbers. So again, this is really great news that we're finally turning the curve on fentanyl and fentanyl analog deaths. Comparing the managing entities, the highest number of occurrences were reported in the Central Florida Behavioral Health Network region with 2,335 occurrences of fentanyl and fentanyl analogs. The lowest number of occurrences was found in the Thriving Mind South Florida region with 424 occurrences. The region also had the smallest death rate at 14.9 per 100,000 population. The highest death rate among the managing entities was found in the Broward Behavioral Health Coalition region with a rate of 40.2 per 100,000 population. Cocaine-related deaths is shown here for Florida from 2012 to 2022. We see similar trend lines as we did with fentanyl, reaching over 3,000 occurrences in 2017, then reaching its highest peak so far in 2021 with just over 4,000 occurrences. There was a slight decrease in 2022 with just under 100 less cocaine-related deaths from the previous year. So not as big as a decrease as we saw with fentanyl. That's something to be mindful of. It looks like it most likely just plateaued rather than the huge decrease that we saw with fentanyl. But still, again, a decrease in our eyes is good. So this is, again, good news. In the US, though, with age-adjusted rate, cocaine actually increased from 2021 to 2022 for deaths involving cocaine in the US. So just wanted to point that out as well. The total number of occurrences from cocaine-related deaths are distributed here by managing entities. The highest total number of cocaine-related occurrences that caused and were present at the time of death occurred in the Central Florida Behavioral Health Network region with 1,093 occurrences. The lowest number of occurrences were reported in the Northwest Florida Health Network with 217 occurrences. Based on rate per 100,000 population, the highest cocaine-related death rate in Florida was in the Southeast Florida Behavioral Health Network region at 23.0. The lowest cocaine-related death rate was in the Northwest Florida Health Network region with 13.5 rate per 100,000 population. Next is methamphetamine-related deaths among decedents in Florida from 2012 to 2022. The graph shows that each year from 2012 to 2021, methamphetamine-related deaths have increased in Florida. However, in 2022, the number of occurrences plateaued, and we see a slight decrease from 2,934 occurrences in 2021 to 2,918 occurrences in 2022. So we're definitely seeing a plateau in stimulants such as cocaine and methamphetamine, which, obviously we would love to see a bigger decrease, but at least we didn't increase even more for this calendar year of 2022. So again, there are good efforts going on as far as psychostimulants and stimulants with cocaine deaths. For the US, methamphetamine related deaths have also increased though for 2021 to 2022. So again, stimulants like cocaine and methamphetamine continue to increase across the nation. Lastly, we'll look at the methamphetamine-related deaths for managing entities for 2022. The highest number of methamphetamine-related deaths was 1,094 occurrences in the Central Florida Behavioral Health Network region. The lowest number of occurrences were in the Broward Behavioral Health Coalition region with just 63 occurrences at the time of death. Based on rate per 100,000 population, the highest rate for methamphetamine-related deaths among the managing entities was in the Northwest Florida Health Network region with 27.6 rate per 100,000 population. And the region managed by Thriving Mind South Florida had the lowest methamphetamine-related death rate with 3.1 per 100,000 population. And so I quickly went over some of that death and morbidity data, but just the conclusion, just overall, from all the data that we've looked at, alcohol use among U.S. and Florida youth has continuously decreased since 2010. Another highlight is that I wanted to take away with is that marijuana use among youth and adults has increased nationally. Vaping, nicotine, and marijuana among youth remain steady with a slight decrease in overall rates for Florida youth, according to the FICIS. However, vaping nicotine is still a top substance for Florida youth as well as youth nationally. Emergency department visits in 2022 decreased for the first time since 2018. And also, we saw, as I said, total drug overdose and total opioid overdose death rate also decreasing for the first time in 2022. And then lastly, the Florida Medical Examiner's data showing that we've seen decreases in drug overdoses for certain drugs, including fentanyl and fentanyl analogs, which is really great news concerning all the efforts that we're putting into our communities to try and slow down the rate of overdoses. And so that's all I have for You all, and here are the references that you all can also use. The written report for this annual report should be on FATA's website very soon as well. And that also has a more deep dive into some of the data we went over today. So I appreciate everyone's attention. I know this is a lot of data to go over. The slides will be given to you, so you can go over the data on your own as well. But I really appreciate everyone's attention and thank you so much. I'll turn it over back to Robert.
Thank you so much, Ben. I do have two quick questions. I think they're the only questions I've seen in the chat. On the conclusion slide, when you talk about the rates of marijuana use increasing, does that refer to all types of marijuana use, not just vaping?
Um, that excludes vaping. So all types of marijuana excluding vaping.
Okay. And then I saw this question earlier in the presentation, but do the marijuana rates, do those include things that you can find like that are legally available, such as like at a CBD shop?
I'd have to look at the survey questions to see what types of what falls under that.
Gotcha. Okay. Perfect. Thank you. I believe that's all the questions that I saw that
Okay.
were needing answered. I did just see a question about the slides. I have posted those in the chat. If you could hang on for just a couple of moments, everybody, I'm going to go through a couple conclusion business items. First and foremost, as Ben said, this presentation is an overview of the annual report. The annual report should be published within the next week. The annual report will feature all of this data along with a more in-depth written analysis. So if you're feeling like some of this data was a lot to go over in an hour and a half, you're not alone. That's okay. The written report will be available for you on our website, and you should receive an email notice as well. You can look that over and get some more detailed information. We have included Ben's contact information. If you have any additional questions about this presentation or the report itself when that is available. Please see the chat panel for a link to the evaluation. Please also note that when the webinar concludes that your internet browser should populate a message that looks like the image on the screen. It says a host or presenter would like WebEx meetings to open a website on your computer. Please note that is not spam. That is WebEx trying to redirect you automatically to the evaluation. So click continue and go ahead and fill that out. To complete the evaluation, you must sign into a FATA account. If you do not have an account, you can register for one at no cost. You can do so by clicking underneath the login boxes where it says haven't registered yet. Please make sure that if you need to register for an account that you use the same email address when you register for the FATA profile as you did when you registered for WebEx. So if you use a work email address to register for today's webinar, please use your work email address to register for a FATA account. This is the only way for us to connect your attendance with your profile. For CEs to be reported to CE Broker for Florida licensed healthcare practitioners, please provide an accurate Florida Department of Health license prefix and number the first time you register. If you need to add or update your license, you may do so by logging into your account and clicking edit on the professional information section of your profile. You will get another opportunity to complete the evaluation later today. It should come from a follow-up email from WebEx. So be sure to check your email and your spam folder for that email. Please note that the evaluation deadline is the end of the day on Tuesday, June 25th, 2024. If you need help logging into your account, registering for an account, or completing the evaluation, you can fill out a contact us form on our website or email training@floridabha.org. Please note that we do not email statements of credit. Instead, after we verify your attendance and the completion of the evaluation, A statement of completion will be posted to the professional development section of your profile in your FATA account within 30 business days. You must have attended the entire webinar and completed the evaluation. We are not permitted to provide partial credit. The recording and materials used in today's presentation will be available on the FATA website within 30 business days. To access the recording and PowerPoint for today's presentation or any previous presentation, visit www.fata.org, navigate to the Resource Center tab at the top of the screen, and click on Training Library. Thank you everyone for participating in today's webinar. Thank you again, Ben, for your time and information. We'd also like to recognize and thank the Florida Department of Children and Families for funding today's education. Have a great day, everyone, and please hold for the evaluation.